Hi everyone, welcome to my YouTube channel. Today's topic is what Medicare Part D drug plans cover. Let's get right into it. Medicare drug plans are offered by insurance companies and other private companies approved by Medicare. Medicare prescription drug coverage or Part D helps pay for both brand name and generic drugs. Many Medicare drug plans and Medicare health plans with drug coverage place drugs into different levels called tiers on their formularies. Drugs in each tier have a different cost. Now I will elaborate on the covered prescription drugs, generic drugs, and tiers. Medicare drug plans and Medicare Advantage plans with prescription drug coverage have their own list of what drugs are covered, called a formulary. The formulary includes at least 2 drugs in the most commonly prescribed categories and classes. This helps make sure that people with different medical conditions can get the prescription drugs they need. All Medicare drug plans generally must cover at least 2 drugs per drug category, but plans can choose which drugs covered by Part D they will offer. The formulary might not include your specific drug. However, in most cases, a similar drug should be available. If you or your prescriber, who can be your doctor or other healthcare provider that is legally allowed to write prescriptions, believes none of the drugs on your plan's formulary will work for your condition, you can ask for an exception. All Medicare drug plans have negotiated to get lower prices for the drugs on their drug list, so using those drugs will generally save you money. Also, using generic drugs instead of brand name drugs may save you money. Let's talk about generic drugs. The Food and Drug Administration or FDA says generic drugs are copies of brand name drugs and are the same as those brand name drugs in dosage form, safety, strength, route of administration, quality, performance characteristics, and intended use. Generic drugs use the same active ingredients as brand name prescription drugs. Generic drug makers must prove to the FDA that their product works the same way as the brand name prescription drug. In some cases, there may not be a generic drug the same as the brand name drug you take, but there may be another generic drug that will work as well for you. Tiers. To lower costs, many plans offering prescription drug coverage place drugs into different tiers on their formularies. Each plan can divide its tiers in different ways. Each tier costs a different amount. Generally, a drug in a lower tier will cost you less than a drug in a higher tier. Here is an example of a Medicare drug plan's tiers. Your plan's tiers may be different. Tier 1 has lowest co-payment and most generic prescription drugs. Tier 2, medium co-payment, preferred brand name prescription drugs. Tier 3 has higher co-payment and non-preferred brand name prescription drugs. Specialty tier comes with highest co-payment and very high cost prescription drugs. In some cases, if your drug is in a higher tier and your prescriber, who can be your doctor or other healthcare provider who is legally allowed to write prescription, thinks you need that drug instead of a similar drug in a lower tier, you or your prescriber can ask your plan for an exception to get a lower co-insurance or co-payment for the drug in the higher tier. Plans can change their formularies at any time. Your plan may notify you of any formulary changes that affect drugs you are taking. I end my presentation with a reference slide. If you enjoyed this video, please show your support by subscribing to my channel. Thank you for watching. Bye now.